Hi guys, so please we are coming to talk about perioperative nursing. Perioperative nursing. Perioperative nursing is a term used to describe the activities and responsibilities of a nurse before, during and after surgical procedure. Perioperative nursing is a term used to describe the activities and responsibilities of a nurse before, during and after surgical procedure. So with this one, we have phases of perioperative nursing. So let's move on to the phases of perioperative nursing. So with the phases, we have one, preoperative phase. Preoperative phase. 2. We have intraoperative phase. Intraoperative phase. Then 3. Post-operative phase. The moment you hear pre, it means before. Pre means before. Then intraoperative means during. Then post-operative means after. So we have preoperative phase. So preoperative phase talks about the activities or the responsibilities of a nurse before a surgical procedure or before surgery. What are the things that the nurse is supposed to do before a surgery will take place? Then intraoperative phase. Intraoperative phase means that the activities of a nurse or the responsibilities of a nurse during a surgical procedure. During a surgical procedure or whilst a surgical procedure is ongoing. Then the last one is post-operative phase. With the post-operative phase, it talks about the activities or the responsibilities of a nurse after a surgical procedure. The preoperative phase begins when a decision for the surgical procedure is taken and also ends as soon as the patient enters the theater room. The preoperative phase begins when the surgical intervention decision is taken and also ends right after the patient enters the theater room. Then the intraoperative phase. The intraoperative phase. The intraoperative phase begins after the patient has entered the theater room, and it also ends right after the patient has entered the recovery room. The intraoperative phase begins after the patient has entered the theater room and ends as soon as the patient gets to the recovery room. Then the post-operative phase. Post-operative phase begins after the patient is admitted at the recovery ward and ends after this one follow-up evaluation is done or review is done. So the post-operative phase begins after the patient is admitted at the recovery ward and also ends right after follow-up evaluation or review is done. And the review can either be at the hospital or at home, depending on the patient's condition at that moment. So please, during the preoperative phase, we have psychological, we have physiological, we have physical, we have socioeconomic and spiritual. So please, I'm coming to talk about each and every point here. So let's take the psychological. So before a surgical procedure is performed, the nurse is supposed to prepare the patient psychologically. The nurse is supposed to prepare the patient psychologically. And how will the nurse prepare the patient psychologically? The nurse can do that by allowing the patient to ask more questions in order for his or her fears or anxieties to be allayed. So before a surgical procedure, nurses are not supposed to explain surgical procedure to patients. What nurses do is that we re-emphasize on the explanation given by the surgeons. We re-emphasize on the explanation given by the surgeon. So nurses literally do not explain surgical procedure to patients. However, we re-emphasize on the explanation that was given to the patient by the surgeon. So you ensure that the patient has really understood the surgical procedure by re-emphasizing on the points the surgeon has already made. So you can also allay fear and anxiety from the patient when you introduce the patient to the theater setting. So before a procedure or a surgical procedure will take place, you need to make sure that you have introduced the patient to the theater setting. You explain the equipment and everything that is there, the theater table, how it is set up and everything, so that the patient will be convinced enough that the surgery will be safe and conducive. Physiological. So with the physiological, you need to check the patient's HB. You check vital signs. You make sure that they have done this one, clotting time and the rest, so that in case of anything, there can be easy intervention. So especially the HB. So if the hemoglobin level of the patient is not checked before a surgical procedure, it can result in a lot of complications. So with the physiological, you make sure that the patient is hydrated and the nutritional status of the patient is also good. You check vitals, you check the HB, you check the clotting time, the clotting factors and the rest, so that in case of any complication, we'll be able to trace it and solve it immediately. And ensure that the patient has emptied the bladder so that it wouldn't interrupt the surgical procedure. So supposing they are going to perform the surgery in the abdomen, if the patient has not emptied her bladder, it means that it's going to affect, or the surgeon might have cut the bladder. So the patient is supposed to empty the bladder in order for the surgery to be safe. Physical aspects. So with the physical, you need to make sure that if shaving is required, you need to make sure that you have done it. Then you secure the place with a tape so that there wouldn't be, the place will be sterile for the surgical procedure. And also, if dentures are supposed to be removed, bangles and jewelries are supposed to be removed, you need to do that before the patient undergoes that surgery. You need to ensure that the patient is physically fit for the surgical procedure. Then the next one is socio-economic. You need to, as a nurse, you need to also seek. You need to confirm whether the patient is financially stable, where the help is coming from, how are they going to get money to sponsor that surgical procedure. So if the patient is not financially stable, you need to consult a social worker at the hospital so that they can help. Let's move on to the spiritual aspects. So with the spiritual aspects, you need to make sure that you need to confirm the religion of the patient. Whether the person is a Muslim, the person is a Christian, the person is a Buddhist, or the person is a traditionalist. So depending on the patient's religion, you need to make sure that one of the leaders or the religion's leaders have said prayers for the patient. So let's assume the patient is a Christian. So you need to consult the hospital's chaplain or maybe the patient's pastor to come and pray for the patient before the surgical procedure will be performed. So please, let's move on to intraoperative nursing. Intraoperative nursing. So intraoperative nursing is a term given to the activities and responsibilities of a nurse during a surgical procedure. during a surgical procedure. So during the surgical procedure, what is expected of the nurse? Now, you need to continue reassuring the patient. You need to continue reassuring the patient. You need to keep reassuring the patient that the surgical procedure will be successful. You keep reassuring. You continue to check vitals where necessary. Then you also assess. You can also act as the circulating nurse during this phase so that the surgical procedure will be successful. Let's move on to post-operative nursing. Post-operative nursing. This is a term used to describe the activities and responsibilities of a nurse after a surgical procedure. So, as soon as the patient who has undergone the surgical procedure gets to the recovery ward, as a nurse, you need to check for the level of consciousness. You check whether the patient is responding to stimulus. After that, you need to also check the site, whether there is bleeding or there is an abnormality. You need to also check vital signs. Very, very necessary. You need to check vital signs. You need to ensure that the patient is made comfortable in bed. If there is a particular hydration that you have to do, you need to do it. You need to hydrate the patient. So after the surgical procedure, you need to hydrate the patient. So you need to infuse prescribed infusions. You need to set up prescribed infusions for the patient. Yes, because during the surgical procedure, the patient might have lost a lot of fluid during bleeding. So you need to ensure that you replace the lost fluids. You need to also give prescribed medications. And among others. So this is all about perioperative nursing. You can read more in your books to get better understanding.